Hi, it's the nursing professor here today to show you how to use a concept map where we're talking about the neuro system. And so I'm going to give you detailed information, but pretty much information that you'll need for studying and being prepared for your final exam. All right, y'all. So this is a concept map, okay? And so this is the broad picture of it, which you're probably not going to be able to see the words. So let me drill down and give you the particulars one by one. So we're going to take a look at the neuro system here. And a medical diagnosis for a person with a neuro system problem can include those that have a CVA, which includes stroke and TIA. Note the difference is a TIA are mini strokes. They're strokes that usually resolve themselves, but they can be a signal that a major stroke is on the horizon. A TBI is a traumatic brain injury or closed head injury, usually comes from some sort of accident. MS or multiple sclerosis, encephalopathy, aneurysm, migraines, tumors, hypo and hyperglycemia. I know we usually put those with the endocrine system, and they do belong there. However, many times their symptoms will show changes in their neurostatus. Dementia, seizures, epilepsy, paralysis of the spinal cord that result in a spinal cord injury. So all of these are possible medical diagnoses that we're going to use the nursing process to gather information to pull it all together so you can use for studying when you're studying the neuro system. All right, so first on the list, assessment. And so the first step here, you see a Glasgow Coma scale. You should note that the scoring goes from 0 to 15, that anything less than 3, the person's in a coma. So Glasgow Coma measures the response to eye-opening, best verbal response, and best motor response. So it's assessing the function of all of those cranial nerves that you should know. And there's an associated score that is that goes with that. And so the scale says that if a person is over 13, let me try to focus here a little bit, then it's considered to have mild effect from whatever the injury is. Moderate effect would be between 9 and 12, and severe is less than 8. And as I said, if you're less than 3, then you're in a coma. All right, another assessment tool that we use is the NIH stroke scale. It goes from 0 to 3. 0, the person is alert and keenly responsive, so that would be like you and me. 1, they're not alert, but they're arousable by minor stimulations to obey, answer, or respond. 2, they're not alert at all. They require repeated stimulation to attend, or they're obtunded and require strong or painful stimulation to make movements. And then 3, they respond only with reflex motor or autonomic effects, or totally unresponsive, flaccid, and areflexed. And those people at that state are really in bad shape because there's lots of injury that has happened to the brain. All right, next on our list of assessment are assessing the cranial nerves, trying to get them all in here. There are 12. And so you should study these by sectioning them off by what's sensory, what's motor, and what's both sensory and motor. And there's only a couple that are both sensory and motor, so you should be able to pull those pretty easily. They are trigeminal, facial, and then actually some of 10 is also both sensory and motor. Okay, so know what each of those cranial nerves do. Last type of assessment we look at is level of consciousness, and this one you're probably most familiar with because we ask a person a series of questions to assess whether or not they are alert and oriented. All right, so next on our list is coming up with a nursing diagnosis, and this is based upon what we were able to assess. So it should address the symptoms of the patient. So some samples or examples of nursing diagnosis can include alteration in comfort, like if a person has pain, alteration in mental status, if a person has some level of confusion, alteration in electrolyte imbalance, in particular sodium, Remember, a normal sodium level is between 135 and 145. And so frequently when a person has an abnormal sodium, one of the symptoms you'll see is confusion. Safety, we're very much concerned about safety. If they've had a stroke, we're concerned about ineffective cerebral tissue perfusion. Like there might be another clot that's not allowing full tissue perfusion. Impaired physical mobility, self-care deficit, risk for infection, risk for falls, and knowledge deficit. Pay attention to knowledge deficit because regardless of what disease process that a person has and regardless of what their background is, we should always approach them from a point of knowledge deficit to make certain that they understand about the illness and its effect on them, which can really, really vary. So don't be afraid that a person who, say, has a PhD and think that you don't need to address things that would address knowledge deficit, because you should. All right, so that's our assessment, that's our nursing diagnosis, and we come to our plan. Sorry. All right, so here we go with our plan. We need to come up with what it is we're going to try to do. And so our goals should be SMART, they should be patient-centered, and by SMART we mean they should be specific, measurable, attainable, relevant, and time. You should include both short-term goals and long-term goals. Short-term goals ideally should be achievable in a few hours to a few days, whereas long-term goals are typically achievable in a week to a month. All right, so what I mean by patient-centered, you can't look at everybody and say everybody that has a stroke needs to do this, because you have to be able to determine your plan based on your assessment and only address the issues that are impacted for that particular patient. They should be specific. For example, if you have a person that has some impairment in their ability to walk, then it's much better to have the person will ambulate 10 feet within 2 days. Because anybody coming after you could be able to assess that, as opposed to you being able of a person will be able to walk short distances after 2 days. Well, what is a short distance? What's a short distance to you might be a different short distance to another nurse. So goals need to be measurable. They should be attainable. A person that had a stroke 9 times out of 10 is not going to be able to run a 5K tomorrow. And so therefore that would not be an attainable goal for someone who had impaired mobility. Should be relevant. It should be relate to that patient. So if we're talking about mobility, then your plan needs to include goals that address mobility. And time, as I said, you need to be able to identify if the person should be able to achieve this within 2 hours or 24 hours or 2 days. So it's very important that when you're looking at planning that the goals should reflect that. Now, this is one of our favorite parts that we do as nurses, is that we intervene or we create action. And so our actions include treatments, medication, physical therapy, occupational therapy, assistive devices for mobility, because we want to make sure our person ends up being as independent as possible. Teaching is always a part of the intervention that you're going to give to your patient and the patient's family. And of course, medications. And so if we're using the example of a stroke, then some of the medications could be TPA, which does have a time limit. It works best between 3 and 4.5 hours. So along with doing your assessment of a person who comes in with signs and symptoms of a stroke, is you ask the person who was with them, or if the person's able to answer questions themselves, when did your first symptoms begin? Because that becomes very important to determine whether or not TPA can be used or not. Another medication could be warfarin, Lovenox, heparin, aspirin, antiplatelets. Remember that antiplatelets work a little bit different than anticoagulants. Antiplatelets are, an example is Plavix, and it's used for prevention. So your patient may be prescribed Plavix in order to prevent further strokes. Okay, so it is not an anticoagulant, and that difference should definitely be noted. Pain management, if your person has pain, that should be addressed, and that could be anywhere from narcotics to Tylenol or Motrin. Angioplasty is another procedure that can be done for a person who has suffered from a stroke. So angioplasty is a procedure used to widen a vessel blocked by a clot, and it may include placing a stent. A stent is a foreign object that's placed inside a vessel to keep it open, because the idea behind a person having a TIA or stroke is that that vessel gets blocked. And so we want to open it up so that that doesn't happen. So think of it like if you're a person who've ever had a Slurpee, and you get to a point where the Slurpee is really, really frozen, and you might get like a little piece of the Slurpee stuck in the straw, well, that piece has to move in order for you to drink the rest of your Slurpee. So the same way that works is the same way that would work when we're talking about your blood vessels. Nutrition is also very important because we want to prevent further strokes. And so typically people who have had a stroke, they many times have high cholesterol. So we want to teach them about eating a low-fat diet, limit salt intake, avoid high cholesterol foods. When we talk about high cholesterol foods, that's any food that comes from an animal. And so when you think about it, as opposed to you trying to memorize milk, cheese, pork chops, beef, whatever, then just think of anytime you see cholesterol and it requires you to know what a high cholesterol food, then that is food that comes from an animal source. All right? All right, last but not least is to evaluate. Did it work? If it didn't work, you got to start all over again. You got to reassess and see what is actually happening with your patient. And so that is the down and dirty of a concept map. Hopefully you're able to do a still frame shot of this because you can use this with any system. My plan is to do a head to toe. So of course head would be neuro, and next come down to the GI system where we will talk further about where the GI system begins and where it ends and those types of things. So that is it for now. So again, this is a nursing professor. That is a neuro concept map. And hopefully you find it helpful, but comment down below. You're going to see this on my YouTube channel. I want you to comment and let me know what you think. I think it is an excellent way of pulling together all of the ideas because it's at this point, you literally got 2 weeks from tomorrow for most places to do your finals. You don't have time to keep skipping through a bunch of chapters. What I will say, where the hole is that it's going to be on medications because there's so many neuromedicines. But you should know things like if a person has a seizure, that person should have anticonvulsive medications and what they are and what the side effects are. You can group those together because typically a person that takes anti-seizure medications like Depakote, phenytoin, those types of things, the side effects are drowsiness. They are usually very much the same. Pick out something that's different between the two, like phenytoin or Dilantin. Typically, a person has a problem with gingivitis. They can get overgrowth of the gums, and that goes along with that drug, whereas the other anticonvulsive, that doesn't happen. So kind of pick out those things that stand out because they might be brought to your attention. But that would be the best that I would say to you. Just try to group like drugs together as opposed to individually trying to memorize them all, because the truth of it is most final exams are assessing whether or not you can prioritize what your delivery should be. If you find a person having X, Y, or Z, it does want you to identify some things. Like I said, with the neuro system, it's very important that you identify sodium levels. Blood sugar levels will also be important because if a person is experiencing hypoglycemia, then they're also going to be kind of loopy. You know, they're not going to be totally alert and oriented. And the same could be true if the blood sugar is really, really high, hyperglycemia. So those types of things. So of course, I can't address everything that you should have learned the entire semester, but let me know if you find this helpful. Because if you did, then I'll continue to present this way. My thought is that you don't need another lecture because you've had lectures all throughout the semester, but at this point you need to pull all those concepts together. So that's the Nursing Professor. Bye for now.